I'm Tara with Physical Therapy. I'm here to talk to you a little bit about things to prepare you before surgery, what's going to happen right after surgery, and along with that, your goals to get you to go home, right? That's what everybody wants to know about. So as far as we're concerned today, the good news is since you are an anterior hip, which means Dr. Lang is doing your surgery and she's coming in through the front, you do not have any precautions. So some of the things we usually talk about will just kind of go by the wayside. So first of all, we're going to talk about the walker and the steps to go over that stuff so that you can practice it before you come to the hospital, or at least have an idea for when you get here what we will be doing. So on your sheet that was given to you, you will have this first part here. It talks about the walker. Everybody starts out with a standard walker, so a walker that doesn't have any wheels on it, so 4 pegs. If you are borrowing a walker from somebody, see if it comes with the wheels on the front as well. If you need to purchase a walker, see if you can buy one that has the wheels on the front as well. I'd like to say that everybody will eventually use wheels, but I just don't know until you get here. So we'll start out this way, it's more safe, and then as you're able, we'll progress you to the wheels. Okay, so to properly use a walker, if you had surgery on your right leg, you're going to move the walker to the end of your toes, step into the walker with your right leg, push through with your arms to give you some support, and then move your good leg in. So it goes walker, sore leg, good leg. The walker is more for your stability purposes so that you're not kind of weeble-wobbling around. That's how we use that. Keys to using a walker is 1, don't step past the front bar because we don't want you to tip backwards. 2, we don't want you to push the walker too far forward because we don't want you to actually accidentally do a Superman and go flying. And the last part is when you walk, take good steps into the walker. Don't take your little mini short steps, okay? We need to exercise that hip and move it through the walker. That's the first part of using the walker. In your joint book, which you would have received at your PACE appointment, you'd find how to use the walker or the setup of it on page 31. So the next part is of that book, page 33, talks about your stair setup. First off, if you have a platform step or you have consecutive steps but you can fit your whole walker on each step, you're going to do it this way. Walk up to the walker or up to the step with your walker, put the whole walker up. You're going to go up the step with your good leg. That leaves your bad leg behind, but the reason for that is it makes your good leg do all the work to lift yourself up. So up to the step, up with the good leg. To go down the step, you put the whole walker down, go down with your bad leg, like that. So up with the good, down with the bad. Good go to heaven, bad go to, you can fill in the blank. Now if you have multiple steps in a row, we would highly recommend that you have a railing on one side. Doesn't matter which side, but that will give you more support instead of just holding onto your coach's hand. You'll turn the walker sideways, so it's where you are and where you're going. Hold onto the railing, hold onto the walker. You're going to go up with your good leg. So up with the good leg, bad leg, move the walker to the next set of steps and go back up. To go down, place the walker at the edge of the steps and towards that railing. Turn it sideways, so it's where you are, where you're going, railing, walker, down with the bad leg, and then the walker, and down with the bad leg. Okay? That's your basics for the steps. I have a variety of steps here that you can try, but if they're very narrow this way where you don't think the whole walker will fit on the steps this way, they can fit this way and it will be okay. If they're very narrow this way, you don't think the walker will fit next to your body, then we're going to use a cane on one side, but it's definitely important to have a railing to hold on to. Okay? So that stuff, like I said, is on page 33 of your joint book. The next part I want to talk to you about is finding a comfortable place to sit at home. So you don't really have any restrictions as far as it's concerned about height of the chair, things like that. Just know that when you have a joint replacement, sometimes it's hard to get up from a really low surface. So you do want to kind of have it where if you're sitting, that your knees are a little bit lower than your hips, only for the fact of the matter that it's easier to stand up that way and you're not really crunched up in your chair. So kind of walk around, find some armrests, things like that where you can sit up and down stand up and down from it easily, and make sure it's not fluffy so your bottom kind of sinks down in and you're too cushy in there that you can't push yourself up. We just don't want you to walk in and sit down and then not be able to get back up until somebody helps you. So check out a few of those things. Usually about 20 to 21 inches is about the best, but it can vary based on your height and your abilities as well. This talks a little bit about it in page 32 of the Going Home section of your joint book. The next part is make sure your doorways, things like that, can fit the walker through it, so roughly about 23 inches at least. At night, most falls can occur at nighttime, regardless of the surgery. The older you get, that's more likely as well, so we want to make sure that you have night lights throughout your house. That way, in case you have to get up in the middle of the night to use the bathroom, your path is lit up. So I say my path is lit up at my house as well because I have a little one at home and I have another one on the way, so I don't want to fall as well. In the same respect, put a glass of water next to your bed so that way you can easily have something to drink and you don't have to get up to get the water or have your coach to get it for you. As far as your bed is concerned, if you have a very tall bed at home, you might need a footstool to ease your way in and out of bed. We'll kind of play with that when you're here, so just keep that in mind. If it's very tall and you're not, then we might need a footstool, but we can, like I said, figure that out when you get here. As far as shoes are concerned, we want to make sure that you have good shoes to go home. So I have tennis shoes on currently. They have traction on the bottom that's pretty rigid. They don't have to be that good for you, but I do want some type of traction so that when you walk, you don't slip and slide all over. They can be slip-on shoes, which is just fine, as long as if you kick your feet all around, you don't lose your shoe. So I don't want you in mid-walk to be missing a shoe. That's the other good part about it. And then last, they have those nice balance shoes out right now. They have the rocker bottoms or bubble bottoms that test your balance. Don't use those quite yet. Save those for later when you're doing better. You don't need to stress your balance anymore. The last part is in your joint book that you would have gotten at your PACE appointment has your exercises in it. So there's 5 on this page and 1 on this page. If you can do these before surgery, that will only help you. So I do realize that you have an old hip in there right now. You're going to be getting a new hip, so these might be a little sore and painful. If they hurt, don't worry about doing them, but if they feel okay, I would practice them before surgery. So usually these first 3 are pretty easy for everybody to do prior to surgery. The rest of them might be a little painful. So once you get to the hospital, we'll do them 10 each, twice a day. When you go home, you'll do them 3 times a day, 10 each as well. So practice those before you come home. This next page, it talks about bed mobility. You can kind of just cross that out. So it might be easier for you to get in and out of bed this way, but you don't have any restrictions, so you don't have to worry about this part of the book, okay? If you're used to getting in on your side or rolling over, that's fine. That's what we'll do here, so don't worry about any of that. So that's the basics for before surgery. We do hand you a sheet that looks like this. Yours has a border around it with your name at the bottom and then a space here for some training times. If you can fill this out and bring it with you the day of surgery, this will greatly help your ability to go home as soon as possible. It talks about how many steps you have, how tall your bed is, who's going to help you at home, things like that. What I found is you're pretty groggy after surgery and your coach is pretty groggy, and sometimes these questions don't get answered correctly right away. So if you fill it out, then we ensure that your goals from day 1 are great to get you home. Okay? The bottom part that talks about who your coach is and who's going to help you at home is important to us because unfortunately I don't get to go home with you after surgery and neither do my coworkers. So we need somebody to come and work with us at the hospital to go over how we did the steps, how you're doing walking, and if you need any help with your exercises. Okay? So there's a few times available. Let's say your surgery is on a Tuesday, then we would ask them to come Wednesday afternoon or Thursday morning. If your surgery is on a Wednesday, it would be Thursday afternoon or Tuesday morning. So the times for that are usually 9 to noon in the morning or 1 to 4 in the afternoon. We say we're kind of like the cable guy. We'll be there at some point. If you need a specific time, please let me know and I will make sure that I get you a specific time. If your plan is to go somewhere after surgery, like you don't think you can go home right away, you need more assistance, we'll figure it out at that point, and we don't necessarily need a coach to come work with us. So please fill this out and bring it with you. It would be very helpful. Now, after surgery, we do have, what generally happens is you go to surgery, then you go to recovery, then you come to zone 31, that's the orthopedic floor. Now, as far as that concerned, when we get a call on this little machine that I wear around my neck, it says patient is coming to room 3102, and if that happens to be you, I look at my watch and say, okay, it's 10 o'clock, that means at roughly 10:15, 10:30, I can come work with you. So therapy usually comes fairly quickly once you come to the floor. If we're a little bit late, just consider yourself lucky. We generally are always here to see you. If for some reason you don't get seen from surgery, you get back too late or something like that, nursing will always get you up that night as well. So don't worry about not getting up. We've just found that the sooner you get up, the better you actually do. Your joints are probably more than one thing is stiff on you. It's probably not just your hip that's sore, so we need to get you moving faster and you usually recover quicker. Our plans for that day are to review your exercises that you've done, to get to the edge of the bed and then try to walk at least 30 feet, which is from your bed to your carpet and back to bed. Okay? If you can't go quite as far, that's okay. Like I said, nursing will also work with you. If you can go further, that's great. We'll go further. So you'll walk with nursing or get up with them at least 2 more times that night as well. Then we'll see you twice a day while you are here. And then your plan is to go home 2 days after surgery. So if surgery is on Tuesday, plan is home Thursday. Wednesday, plan is home Friday. Your goals to go home are 1, to walk 150 feet. So if you did see the long hospital hallways, those are 200 feet, so it's a little bit less than that, would be your goal to go home, walking that all at once, to do your necessary steps to get in and out of your house, or if you have a ramp, and then to be able to do your exercises either by yourself or with your family members. So those are our basic goals following surgery in order to get you home, okay? So those are the biggest recommendations that I have. Just remember that you went through a big surgery, so you're going to have some soreness and some pain, but we'll help you through that, as well as you'll have medications and things like that. So I do realize that this can be a little painful, but a little bit of pain for a lifetime of feeling better is fantastic, right? That's what I say. You're already in pain now, so if we can get through it and feel great, that's wonderful. Fill your sheet out, please, and that will be helpful to you and I after surgery. Okay? If you have any questions, write them down, let me know, and we can help you with them when you get here. Thank you. We'll see you later.
Okay, my name is Eileen. I'm an occupational therapist here at the hospital, and I'm here to tell you a little bit about the role that occupational therapy is going to play in your recovery after your surgery. Occupational therapy will be seeing you twice daily while you're here in the hospital, and we'll be working with you on what we call the activities of daily living. So we want to be sure that you can do things such as make sure you have a good plan at home for bathing yourself, for getting dressed, using the restroom, and planning meals. So I'm going to go ahead and kind of go through these categories one by one. We do ask that you plan to have your coach come in during your stay to be trained on some of these items as needed. So I'm going to start with giving you some information about bathing. What we use, the only restriction with bathing that we have is that the incision cannot get wet initially. So as long as you have that dressing on there, we want to make sure that it stays nice and dry. We use this Glad Press and Seal plastic wrap. It's sold at the grocery store right next to the Saran wrap, but make sure that you get the press and seal. It's sticky on one side, and then you're able to just tear off the amount that you will need to cover the incision, and it will just go ahead and stick over the top of the dressing and make sure that it stays dry throughout the shower. You are allowed to get into the shower right away. You will not be allowed to get down into the tub right away. If that's a question for you, you'll have to address that with your doctor. If you are going to be getting into the walk-in shower, you can walk right in with your walker and use that to assist you with getting in and out. You can also use a seat, such as this one, if there's room in the walk-in shower. A lot of times in those showers, there's not a whole lot of room. And so some people ask me about the built-in seats, and I just say to use caution with those because they can be low and slick and difficult to get up and down from. If you have room for something like this shower seat, it might be something to consider for giving you a little bit more support with your shower. If you have a tub shower, there's a few things to know. We don't want you stepping up over the ledge of the tub right away. So you may need to either sponge bathe initially or plan to obtain some kind of bench to help with getting in and out of the shower without having to step over the ledge of the tub. And I'll demonstrate that for you now. This here is a standard tub bench. It's, all 4 legs fit onto the inside of the tub, and it has a 250-pound weight capacity. So what you would do, I would back up to the ledge of the tub. I would go ahead and kind of reach back and take a seat. This seat's a little low for me. And then I would just scoot back and bring my legs up over the ledge of the tub. And that's going to allow me to get into the tub shower without stepping up over the ledge. I would exit the tub the same way. And we do usually ask that you have someone present with you to practice this, at least initially at home, because the shower is a common place for falls and we don't want you taking a fall. There's also a couple other models similar to this one that are a little bit longer. There's one that's called an extended tub bench, in which 2 legs fit on the inside of the tub and it extends out over the ledge of the tub, and the other 2 legs are on the outside. That one runs about $100. It is a little bit wider and of course longer, and has a higher weight capacity of 300 pounds. I'll also talk a little bit about getting dressed. You'll be wearing knee-high TED hose to help prevent blood clots, and those will be worn for about 3 to 6 weeks or until your follow-up appointment with the doctor. They are just worn during the day so they can be removed at night when you go to sleep. Sometimes people need a little bit of help with getting those up and down. Usually you can rely on a family member or a friend to help with that. Again, you don't have any precautions. So as long as you're comfortable, we kind of say let pain be your guide. You know, it may be painful for you to be bending forward, and so if that's painful, we ask that you avoid it, in which case you may rely on a family member or friend to help you with managing that clothing. If you do not have a family member or friend that will be able to consistently assist you, we do have some devices that, should you need them, we could show you in the hospital here how to use those to assist. We do ask that you bring a couple of sets of clothing with you to the hospital, because we do have you practice getting dressed while you're here. So the more comfortable, the better. Elastic waisted pants or shorts work pretty well, kind of pajama style clothing, we say. But we do want you to practice getting dressed. Again, bring a comfortable pair of shoes, something that you would normally wear, and we can make sure that you're able to put those on as well. So those are the big things with dressing. You know, just know that you might not be able to do all of your dressing independently right away, but you do not have any precautions. We'll go ahead and talk next about seating surfaces at home and using the toilet. You may have a little bit of difficulty because the toilet is a low place, you know, to get up and down from. So you may need a riser or something placed on top of the toilet to give you a little bit of extra height. This here is a toilet riser. It's about 5 inches tall and it has arms to help with getting up and down. So that may be something that you need. What I typically tell people is that we can usually get a pretty good idea when you're here in the hospital of if you're going to need something like this, and then we can, you know, help you along as far as being able to obtain this equipment, either through our home medical store or we can direct you to another place that you'd be able to obtain it. One thing to know is that these products are unfortunately not covered by insurance. And so they are an out-of-pocket expense, which is why we want to really make sure that there's something that you need before you go out and buy them. So we can work with you while you're here to determine whether or not you're going to need this equipment, and if so, how to obtain it. Another thing at the toilet, you may already have a high toilet at home, so if that's the case, you may think about a grab bar might be a good idea, or a toilet safety frame to assist with getting up and down if you already have the toilet that's a little bit higher than normal. Another thing that we talk about, of course, is home safety. So we want to make sure that you're prepared for surgery in advance, and some things that you can do to make sure that you're safe at home. What we typically would say is if you can, you could prepare some meals, you know, simple to prepare meals in advance so that when you do get home you're not too worried about that. it can be difficult with the walker to be able to transport items. So getting yourself something to eat or drink can be a little bit of a challenge. We do have some walker baskets, a couple different kinds that we sell here that would allow you to transport items much easier. And this is a great option if you're going to be home alone during the daytime and have to get yourself something to eat or drink. This is about $25 from our home medical store. So that's a good option. And then of course, we always talk about just being safe in the home, and we'll go over more recommendations as you get here. But obtaining a reacher or a grabber is usually a good option as well, so that you're not taking any risks bending down to the floor to pick anything up. Another thing to know, I know we've spoken about that you won't be having any precautions. This will be hanging in your room, just to let everyone know that even though you've had a hip replacement, you will not be following any of the precautions. So this is kind of a reminder that you won't have to follow those. So I know as Tara spoke about, we do ask a lot about your home setup, but we do that so that we can practice those things with you before you go home. We want to make sure you're safe with all of these things, like getting dressed, using the bathroom, bathing, showering. So we do ask that you fill those sheets out to the best of your ability. And if you do have any questions, you could jot those down on the back of that sheet, and that'll come straight to the therapy department. So if you have any questions about any of the information that we've presented, you could go ahead and write those down on that sheet. And that's all I have, so we will be seeing you in the coming weeks here.
Good morning. I am Gretchen Ulmer, and I am one of the nurses here at Mercy Medical Center. I work on the orthopedic and neuro floor where you will be coming after your surgery. So today I'm going to talk about total joints replacement, the hip and the knee, and just the nursing part about that. So when you come to the hospital, you will be parking on the second floor, the south side of the parking ramp. When you go in, they will ask for a photo ID, and they will get you all signed in. They will bring you back to the room to just get your gown on to start an IV, and then you will meet with the surgeon and with the anesthesiologist. At that time, if you have any questions, they will be willing to answer them just to make sure that you feel comfortable with the surgery and the things that they will be doing. If you are having a knee surgery, it will probably take about an hour to an hour and a half, depending on your situation, but that's usually what we say. If it's a hip surgery, it's usually a couple hours, so just kind of plan on that. I always tell families when they come to the waiting room, it's usually pretty cold, so to bring a warm coat. They do have blankets there if you are needing one while you wait for the surgery to be completed. When the surgery is done, the patient that has had the surgery will go to what we call PACU, which is just a recovery area. We will look at the vital signs, make sure you're doing okay breathing, your blood pressure's okay, your heart rate's doing okay. We look at your pain. And then after you are stabilized and you're ready to come to the floor, you'll come up to the third floor with where I work. Your family will be brought by a volunteer, and they will be shown into the room and made comfortable. We have a program at Mercy Hospital called the Care Partner Program, and this is a brochure, this is a little form that we have, and it just tells you that as a care partner, we want to make sure that we are taking good care of you too, because studies have showed that if we are caring for the patient's family member or friends, that the patient is much more at comfort level and is willing to work with the families and the staff to do what is needed so that they can get better quickly. So we want to make sure for the care partner that we are taking care of you, so just please communicate any needs that you may have. Another thing that a lot of people have questions about is regarding pain. So we want to make sure that when you come on our floor, that even though we're still looking at your vital signs, making sure that your blood pressure is doing well, your heart rate, that sort of thing, we also want to make sure that you know we are going to be watching how your pain level is. So we have in every room, it's not this big, but we have a scale that we ask quite often what you're rating your pain at. And this is what we want you to look at. 0's no pain, 10 is the worst, and that helps us kind of get an idea of where you're at. But let's say that your blood pressure is you give me a pain rating of 2, but when I take your blood pressure, it's way up high. So even though you tell me it's a 2, if I'm seeing that your heart rate's up and your blood pressure is up, we're going to treat it that you have probably more pain than what you're stating. With the doctors, all the doctors are really good at providing different medications for the nurses to utilize for your pain. So when you come on the floor, we will ask you kind of what you have used in the past at home to relieve your pain, just to give us an idea, baseline, what we will start at. With any kind of pain medication, we also have in the rooms a purple laminated sheet. It looks like this. We have you rate what you want your goal of pain to be. So this is a 3 up here. So we just want to make sure that you have 3 as like if that's what you're stating to achieve, written up there. And then we document what your pain medication is, how much you're getting, and what time you will be receiving it. And we'll talk to you in detail about what your medications are and make sure you are understanding them. Usually your oral pain medication that you take by mouth is given every 4 hours, but we come back and check quite frequently to see how your pain level is. So if we would just give you one pain medication, one pill, and we came back in maybe a half an hour, 20 minutes, half an hour later and see how your pain was, if you're still having high amounts of pain, know that we aren't going to wait the 4 hours to give you more pain medication. We're going to go ahead and treat that pain medicine right away to you, just depending on what you're needing. We also provide ice. We want to make sure that with like the knees, that we are putting ice above and below your knee. And we also, for hips, put ice on the surgical site. So that's something that you may want to purchase in advance, are like ice bags. We do have a medical store here at the Mercy Hospital that you can purchase ice bags that are really nice to store in your freezer so you're prepared before your surgical date. And they cost about $7 a piece. So knees, you'd want to purchase 2 ice bags, and hips, you'd want to purchase 1. Another thing when you're on our floor that we're going to be looking at, besides doing our vital signs and looking at your pain, is we're going to make sure that you're doing good with your deep breathing. We want to make sure we prevent any kind of pneumonia issues, so we'll be having you do some really good deep breaths and doing some coughing. We also utilize, and you may be familiar with this, it's called the incentive spirometer. And what you do is you suck through the mouthpiece just like you were sucking through a straw. And then you keep the blue nugget between the 2 arrows. So it would be a nice gradual intake of breath. So this is how you would do it. And then you just relax. We usually ask you to do this 10 times every hour. We won't wake you up in the nighttime unless you get up to go to the bathroom, then we'll have you utilize this. But that's how important this is. And you can bring this home and utilize it too at home. So this is an incentive spirometer. It's very important, like I said before, that your pain is under control so that you can get up and move around, because we want to prevent blood clots. We also use TED hose, which are like white stockings that are pretty secure to your leg. They help just to give security to your blood vessels. And we also use like these little massage things that go around your calves. They're called SCDs, and they just kind of deflate and then they inflate like every 15 seconds. We encourage you to wiggle your toes and wiggle your feet. It's very important just to keep that moving. We check your pulses in your feet. We check your bandage that you come back with after your surgery. Just know that there's going to be a lot of checks that we do. With the dressing that is on, with the knees, you will have your dressing from above the knee to basically to almost to your toes. And then that's for knee surgeries. For hip surgeries, you guys will usually just have like a 4x4 on your surgical site, some kind of a dressing, and then some tape around it. Depending on the doctor and their orders, they may have us change that the next day, or it could be a couple days. It just depends on the doctor what they do. But we will read the orders and make sure we do as they have ordered. If you have staples, those are usually removed 2 weeks after you leave the hospital, and it's usually done at the doctor's office. With your diet, you will have, like I said, an IV, and so we will keep the fluids running, but we will give you ice chips initially. We will have you take fluids, Jello, those light fluids initially to see how your stomach's doing, and then progress after that. If you're doing well with the Jello and you need more soup, something like that, we'll advance you as we see that you're tolerating it well. Before your surgery, you're not going to want to have anything after midnight. You want to make sure if you do take some pills in the morning that you have been okay to take for your doctor, you can take some sips of water, but otherwise do not take anything by mouth. The supper before your surgery, you can have a nice meal, not a whole bunch of food, but just have a nice meal so that it can kind of sustain you for the next day. And then, like I said, then after your surgery, we'll start out with the clear liquids. When you decided to do your surgery, from that moment until you are discharged, we have been providing education so that you feel that you are going to be as safe as you can be and have the most information you are needing to feel comfortable with the cares that you are going to be doing along the way. And so, talking about discharge planning, when it comes to that time, you will meet with the social worker during your stay at the hospital, and they will visit with you to find out how you're doing with physical therapy and occupational therapy. If you're doing really well and your plan is to go home, then as nurses, we'll prepare those discharge papers and then present those to you and make sure that you're understanding them clearly before you leave the hospital. And usually discharge is about 3 in the afternoon you can plan as like the latest to leave the hospital, just so that you kind of have that idea that it takes that long to work with therapy and have the doctors do the discharge orders and for us nurses to get the papers ready to present and provide the education to you. But let's say if the social worker works with you and meets with you and you're not ready to go home, maybe you need to go to a skilled facility, maybe you need home health, just know they will be visiting with you and setting that up with you, and just let them know what you're feeling and communicate your concerns and your needs. That's very important for us. Every morning we meet as a group. It's called Care Conference. So you will meet with a care coordinator during your stay. You may meet with a hospitalist. You may meet with our nurse practitioner, the social worker, of course us nurses. So lots of names, but just know you will get to know us, and then we just want your stay to be as pleasant as possible while you're here. Just know that in the booklet that you receive, usually during your PACE appointment, on the back cover there's a card that talks about total joint replacement. You need to put that card within your purse or wallet, and then anytime you have any dental procedure, you just need to make sure that you know what your doctor and the dentist have communicated regarding antibiotics prior to any cleaning or any procedure that may be done. I had mentioned earlier that you want to purchase ice bags and keep them in the freezer before you come to this for your surgery. Other things you might want to think about so you don't have to do it afterwards, after your surgery, is to have like a multivitamin, to have a bowel softener, and just make sure your pathways are all lit up clearly so you can see in the middle of the night. We find that people get up to go to the bathroom quite often, and we just want to make sure that you're safe. Also your pathways, make sure they're free from like throw rugs. And then the other thing that I want to make sure that you're aware of is that if you come to the hospital, you can bring comfortable clothes with you. Some people don't like our gowns and may want just comfortable shorts or elastic band, sweatpants, slippers that have a good sole, a shirt. That's all fine, whatever you feel comfortable in wearing. And then you can bring your laptop, your tablet, books. I can't guarantee you're going to have a lot of time to do those because we do keep you busy and keep you active. But you can bring those. If you have a BiPAP or CPAP, you'll want to bring your tubing and that along with you. You are, at this point, able to bring inhalers or eye drops. We'll relabel them in the pharmacy, but you can utilize those on our floor. All the other medications you can leave at home. Our pharmacy takes care of the medications for you while you're here. Unless you've had an organ transplant or are on special medications, maybe for cancer, you can talk to your doctor about that or us when you come, but you can bring those medications and we'll relabel those in our pharmacy also. Well, I thank you for choosing Mercy Medical Center, and I look forward to taking care of you.